Hi, I am Dr. Ashit Sharma. I am a consultant general and laparoscopic surgeon. Today I am going to tell you about the commonest surgical problems like hernia. We are taking hernia today. Hernia is a very common presentation in surgical practice. Now, what is hernia? Hernia is protrusion of sac from abdominal wall through the weakest point in the abdominal wall. We can say there is umbilicus. You must have seen ladies, fatty ladies with a bulging coming from umbilical area, that is umbilical hernia. In the same way, inguinal canal. Inguinal canal is a tube which is a connecting link between testis and the abdominal cavity. Sometimes its sac protrudes through this inguinal canal. So this is called inguinal hernia. The causes are, so many causes are there, like whenever intra-abdominal pressure raised, it may cause the protrusion of sac through the weakest point in the abdominal wall. Suppose patient is suffering from chronic asthma, chronic cough or allergic bronchitis. So every time he is coughing, intra-abdominal pressure raises and it may lead to herniation. In the same way, in elderly age group, if you see, for example, a person who is suffering from prostatic enlargement and he strains for urination, so the resulting increase in intra-abdominal pressure, and it may lead to protrusion of sac into the inguinal canal, and that is called inguinal hernia. Suppose person is obese, again a lot of intra-abdominal fat increases and increases the intra-abdominal pressure. Person is doing excessive exercise, including weightlifting. So again he is putting extra pressure inside the abdominal cavity, and this is the cause of herniation. How we can diagnose and how to prevent and how to treat this condition? So first of all, the causative factor should be removed. If he is suffering from chronic cough, that has to be taken care of. He is suffering from prostatic enlargement, that should be operated. And passage should be clear. And if obesity is there, try to reduce your weight. Don't do much heavy extreme exercises. Don't lift much of weight. High protein diet, because in elderly age group, lot of weakness in the muscles are there. So again, this is a cause of the same problem. At Lybrate Medical Center, we treat these hernia problems through laparoscope. Laparoscopic hernia repair surgeries we are doing, that is without any incision and without any prolonged stay of the patient. So this is the basic thing which we can prevent by avoiding unnecessarily increase in intra-abdominal pressures. And one thing is very important, incisional hernia. It is the weakest point where scar is there after post-surgical scar, and it can be protrude. It can protrude through this scar weakening, and that is called incisional hernia. That again is a herniation, and that can be very well repaired by laparoscopic surgery. So you can catch me at my hospital, Lybrate Medical Center, with Lybrate by prior appointment.